But now a new study, the largest of its kind, puts more weight on this grim trend. It says cancer in people under the age of 50 is becoming more common, and how? Cancer cases in the under 50s increased by about 80%, 80% increase, and this happened in the last 3 decades the world over.
Incidence of cancer patient is increasing significantly. If you see, previous was a decade of cardiac patients due to multifactorial reason is on an increasing trend.
There are only a few things which people are well versed with, be it say protein, carbs, fat. How important is the role of protein when we speak about cancer treatment?
It's very important. See, basically, any cancer patient, whenever they are diagnosed with cancer, they are in a catabolic state. Means definitely at certain point of time they will start losing weight and they will have reduced appetite, and weight loss being one of the most important symptoms.
Today we have with us Dr. Amit Chakraborty. Sir, it's an honor to have you in our InBody Charcha Podcast. First, to start with, I would like to tell you about your journey through oncology.
So basically, see, I've done my MS General Surgery from Sion Hospital, Mumbai. And during my training in Sion Hospital, I've seen a lot of patients coming down to Tata Memorial Hospital. They are staying out on the road and they are looking for treatment. So that's where I felt there is somewhere around demand supply gap. And at the same time, we need more qualified doctors, those who are capable of catering to that segment. That is, you treat cancer patient, because the incidence of cancer patient is increasing significantly. If you see, previous was a decade of cardiac patients. Now, since patients have become much more conscious about their daily activities, so the incidence of heart attack has reduced significantly. But cancer, due to multifactorial reason, is on an increasing trend. And it's very important that we need good number of doctors to treat those patients in a meticulous way. And that's where it has motivated me to pursue my career and do super specialization, that is MCH in surgical oncology. I've done it from Gujarat Cancer Research Institute. It's a regional cancer center similar like to Tata Memorial Hospital. It's a regional cancer center of Gujarat. And after training, I've seen the incidence is increasing like anything. But what is most important, nutrition forms an important factor in the overall treatment modality, right? So we should all give importance to nutrition. It's not only the treatment, that is what surgery, what chemo, and how the radiation is going to affect. Because if patient is nutritionally well built, then they are capable of taking over all the challenges in their life.
So, speaking about nutrition, okay, there are only a few things which people are well versed with, be it say protein, carbs, fat. How important is the role of protein when we speak about cancer treatment?
It's very important. See, basically, any cancer patient, whenever they are diagnosed with cancer, they are in a catabolic state. Means definitely at certain point of time they will start losing weight and they will have reduced appetite, and weight loss being one of the most important symptoms. So whenever, if these patients they are not get supplemented with adequate protein, then the body takes a lot of time to recover from the surgical intervention, and if their protein levels are too low in their body, they're not in a position to tolerate chemotherapy or radiation, and they face significant side effect. And we have seen the patients, those who are nutritionally depleted with very low protein levels, we have to stop the treatment in between, which is not good for the overall outcome of the disease person.
So sir, as a layman, I have one question. ये जो न्यूट्रिशन प्रोसेस हम बोल रहे हैं, न्यूट्रिशन थेरेपी, when should it be started? During chemo, prevention करना चाहिए, या what is the best time to start it?
See, ideally the nutrition therapy should be started immediately when you are getting diagnosed with the cancer, right? Today in Indian scenario, आप जब कोई भी पेशेंट एक डायग्नोस होता है इंडियन इसमें, तो उसमें देखते हो 90% केसेस में आपको मोस्टली तीनों चीजें आती हैं, सर्जरी, कीमोथेरेपी एंड रेडिएशन। और ये तीनों चीजों को सक्सेसफुली ओवरकम करने के लिए आपका जब न्यूट्रिशन अच्छा नहीं रहा फर्स्ट डे से, तो आप ये ट्रीटमेंट को सक्सेसफुली कंप्लीट नहीं कर सकते। जैसे एक एग्जांपल, हेड नेक कैंसर का पेशेंट होता है, तो उसका ओवरऑल ट्रीटमेंट जर्नी जो है, राइट फ्रॉम सर्जरी टिल कीमो रेडिएशन इज 90 डेज, 90 दिन का होता है। सो जब मेरा पेशेंट सर्जरी में जाने से पहले उसका न्यूट्रिशन वेल प्रोटीन रिप्लेनिश्ड नहीं रहा, तो माय पेशेंट विल नॉट बी एबल टू कंप्लीट द ट्रीटमेंट साइकिल। एंड जब पेशेंट पूरा सब ट्रीटमेंट समय पे नहीं लेता है, तो उसका ओवरऑल आउटकम बहुत खराब होता है।
So sir, आजकल एक ट्रेंड चल रहा है. You just spoke about nutrition being the core of cancer treatment. प्रोटीन बढ़ गया मतलब रिकवरी हो रहा है. ओके. एंड देर इज अ थिंग दैट पीपल से कि आपका जितना वेट है उतना आपको प्रोटीन लेना है. बट as far as cancer patients are concerned or any patient is concerned, the protein requirements change according to their. So, do you think कि प्रोटीन बढ़ा दिया मतलब रिकवरी होने ही वाला है? Is that a thing?
No, it's a misnomer, it's a myth. ये गलत फहमी है. देखो हमें क्या करना है, बॉडी में जो कंपोनेंट्स कम है वो रिप्लेनिश करना है. उसमें से प्रोटीन एक इंपॉर्टेंट कंपोनेंट है. सिर्फ ओवर इनटेक ऑफ प्रोटीन सप्लीमेंट करेंगे और बाकी जब डाइट हमारा बैलेंस नहीं होगा तो इसमें यू विल नॉट एंटर इनटू यू विल नॉट कम आउट ऑफ द कैटाबॉलिक फेज. राइट. प्रोटीन एक इंपॉर्टेंट पाइवटल स्ट्रक्चर है जो हमारे बॉडी में या फूड कंटेंट में होना चाहिए, जिसके कारण हमारी बॉडी फास्ट रिगेन कर सकती है और एनर्जी परफॉर्मेंस इंप्रूव हो सकता है. बट इट्स नॉट ओनली दैट वी सप्लीमेंट ओनली विद प्रोटीन एंड वी फॉरगेट रेस्ट ऑफ दिस. इट हैज टू बी delivered in a balanced format, because हमने कुछ पेशेंट्स देखा है वो इतना ज्यादा प्रोटीन इंटेक कर लेते हैं, then they come up with different problems in their life like constipation leading to hemorrhoids or piles. ठीक है. We have seen patients landing up suddenly in a kidney failure, right? Because they are not aware कि कितना ग्राम प्रोटीन लेना चाहिए उनके बॉडी में. उन्हें लगता है कि कैंसर हुआ है हमें बस सिर्फ प्रोटीन इंटेक करो, and they don't know what is the excretory capacity of their kidneys, right? So you should be very much cautious, and the entire thing should be done in a scientific way. Just adding few scoops of protein extra into your diet, it does not mean that you are taking a proper diet or nutrition for yourself.
Correct. Along with this, sir, is it really important to gain muscle mass, because cancer leads to cancer cachexia eventually? So how do we prevent it in the first place itself?
See, sarcopenia is the most important concern for any treating doctor for cancer patients. Even if, whether it is a surgeon, whether it is a say medical oncologist or a radiation oncologist, and that factor should be factored in before initiating the treatment. And now at our Tropic Health, what we do, we measure the muscle glycogen content, we must measure the adipose tissue content, and we always try to change the numbers from the sarcopenic state so that we replenish the muscle and maintain the good quality of muscle. So in short, it can be done in a scientific and organized way, instead of performing things in an unorganized fashion. By visiting, say, if you're visiting a nutritionist, you should have numbers before you're starting any sort of formulations. Then you can see the change in the numbers. Then you will understand whether you're really coming out of that sarcopenic state or not.
Right. So now that you have mentioned Tropic being a very beautiful concept of everything under one umbrella, how did this come to your mind that you wanted to do something like this?
So it's a very good question, and in fact, I think a lot of people have asked, and we have answered this question to significant number of people, and we feel very happy and proud that this entire concept got conceptualized by 5 of our friends. 4 are doctors, 1 is a non-medico, and we were just thinking how we can transform the body of ourselves, and few of our co-founders themselves have undergone a transformational journey. जब आपके शरीर में आपके ऊपर आपने कुछ चेंज किया होता है ना, और वो चेंज जब पॉजिटिव चेंज है तो उससे बड़ा ट्रांसफॉर्मेशन कुछ नहीं है. एंड वी वांटेड कि ये जो चेंज हमारे फाउंडर लोगों ने चेंज किया अपने आप में, ये चेंज यूनिफॉर्म होना चाहिए और यूनिवर्सल सभी लोगों के लिए होना चाहिए. काफी लोगों में आजकल ये है कि मैं मोटा हो गया हूं तो मेरा वेट लॉस नहीं हो सकता है, एंड दे गो इनटू डिफरेंट सॉर्ट्स ऑफ डिप्रेशन, डिफरेंट मेडिसिन, गलत ट्रैक पे बिंज ईटिंग करते हैं, एंड दे कीप ऑन गेनिंग मोर वेट. सो व्हाट वी थॉट, व्हाई कांट वी रेप्लिकेट मॉडल एंड क्रिएट एन एसओपी where we provide a uniform treatment, not only in terms of wellness, but it's a sort of restorative preventive health care. See, currently being a cancer surgeon, I see patients from the other side of the table. But when we have initiated this concept, we were seeing the patient on the other side of the table, where we want them not to suffer, to have less medications in their life. And believe me, I feel much more happy to be on that side rather than being treating a... See, once you have a disease, you're treating a sufferer, right? But when somebody is not having a disease or on the verge of getting disease, if I'm reversing his entire lifestyle or the journey of his life, then it gives you much more happiness. Suppose your obesity is gone, your 50% of etiological factors of different diseases are gone. Because obesity is gateway of India for 50 different things. You name a disease, it has got an etiology linked with obesity. तो ये मोटापा जो है, now it is being claimed as one of the chronic disease, right? And which is very important that we can reverse it. It is not irreversible. But only one thing which I want to tell to everyone, it should be done in a scientific way.
Absolutely. Speaking about obesity, we spoke about sarcopenia, which is muscle loss. But the main concern right now, which we are facing along with diabetes as a nation, is obesity. Tell us 3 tips from your end, which people should take as a preventive measure to avoid it in the first place.
See, if you're obese, the most important and foremost thing is that you should start at least 45 to 60 minutes of daily morning brisk walking, right? And in between meals, we have a tendency to have small amount of this or that sort of food. Avoid that, right? What it happens, the more frequently you are taking the food, the more is your insulin spikes. You should not. And third, the most important that your diet should be properly structured, right? What we have to do is we have to reduce our insulin resistance in the body. Then only I'm getting myself less susceptible to have diabetes, right? Because if my insulin resistance is low, I will not have diabetes. So these 3 factors are the foremost important. Your dietary pattern should be good, daily walking, and third is that you should try to do as much as activities in a properly designed manner.
So we recently came across a research study which shows that as much leg muscle mass you develop, it helps you to improve your insulin sensitivity.
Yes.
So, is this the reason why that all the diabetics or everybody who has any sort of ailment is said to be walking for say about 30 to 45 minutes?
See, what it happens basically, to underlie the entire this particular question, the concept is based on the how we can reduce our insulin resistance.
Correct.
Right. Whenever you are walking, so there is a peripheral heart, right, which pumps the entire thing down from to up. So it reduces against the peripheral resistance, and more your muscles are strengthened in terms of calf muscles, thigh muscles, right? Your insulin resistance is on a lower. That's why they always ask you if you are prone to diabetes, perform squatting more in terms of exercise. That will help in your building up the leg muscles. So the concept is based on reducing the insulin resistance of your body. That is the foremost important thing.
So, have you come across a case where the cancer patient was also a diabetic and it became a kind of a hurdle to go forward with the treatment?
See, what it happens, yes, definitely we come about, at least in Indian scenario, there are 10 to 20% of cancer patients, those who are newly diagnosed, they come up with diabetes, not only diabetes, uncontrolled diabetes. And in 1 to 2%, they have got detected the diabetes because of the screening test that they underwent during the surgery, right? But this insulin levels or say raised glucose level is definitely one of the important factors because it helps in delayed wound healing. There is surgical interference. Secondly, a diabetic individual is much more susceptible to have different sorts of infection. So in cancer surgery, most of the surgeries are long-standing surgery. And post-surgery, patient needs to stay in ICU say for 2 days, 3 days. And if these patients are say diabetic, then they are more susceptible to develop respiratory tract infection, pneumonias, which diabetics are generally prone for, right? So treating a diabetic patient and non-diabetic patient, the overall outcome is different. We are much more aggressive in our approach when we are treating a diabetic patient and operating them if their sugar levels are not optimized prior to surgery. Sometimes patients reach with a HbA1c of say 11, 12. We cannot wait for 3 to 6 months to postpone the surgery and get the HbA1c back on track. At that point of time, we switch over to insulin and we try to keep the patient's sugar level within say normal range, less than 200, and at the same time perform surgery and keep a coverage of good higher antibiotic so that they should not develop a secondary infection.
Sir, there is also a term called visceral fat, which is right now talked about a lot. There are a lot of research papers coming on with it. Any tips from your end to reduce this visceral fat because it has a significant correlation with diabetes and CVD?
In fact, it has a relation with cancer also. What is most important? Like I've told you, for any diabetics, you walk for 60 minutes. So everybody's routine in 7 days, say one day can be a cheat day, but out of those 6 days, you perform cardiac activities for 2 days, you perform your, say, walking, running for 2 days, and you do your strengthening exercises for 2 days and core for. Like if you segregate 2 days cardio, 2 days core, and 2 days strengthening, so you are taking care of everything. And one has to be very much sincere every day. See, nobody wants to go to rush to gym or do some sort of activity because in one we are slightly lazy. But it's that, believe me, it's that initial 5 to 10 minutes that is a hiccup. Once you're out and you're on a roll, the next 60 minutes is going to be beautiful, and that 60 minutes you're spending in morning time will keep you much more fresh for next 20 to 22 hours.
So अभी this एक question जो मेरे दिमाग में है, as any individual, any citizen, I would say that cancer जब भी कोई सुनता है तो एक डर पैदा हो जाता है दिमाग में. The moment some member, some family member gets it, the other family members are also equally stressed. We all know that when there is a lot of stress around, cortisol levels are ought to increase. So in this situation of panic, as a doctor, I believe that we are not just treating patients, we need to be psychologists, we also need to be a whole thing to them. So what do you do in such cases of panics?
See, basically, what is most important whenever any patient gets diagnosed with cancer for the first time. So, what we do, a thorough counseling of the patient as well as their family members, because it is the support of the family member which is very important for the patient. If the family is supportive, then this individual is going to sail through the entire journey in a smooth fashion. But if the family members are not supportive or they are confused regarding the treatment here, then I'm 100% confident we have seen they are screwing up their patient's life. Right. So what we believe, we take a holistic approach. We definitely do a good counseling to them, and we overall explain them the entire overall prognosis and outcome. But sometimes we have to follow different protocol based on the stage of the disease. Like a stage 4 patient comes, gets diagnosed for the first time, and it's very much saddening to have disclosed the sad news directly in front of patient as well as their all family members. So what we do things in a slight smart way in which we generally don't disclose the entire thing to the patient directly so as not to down his confidence in the first sitting itself. We give the entire brief to the relatives. They're all aware of the stage. What is the stage? What is the outcome? What are the different treatment modalities? And slowly over a period of next subsequent 2 to 3 visits, we also counsel the patient, and he is also aware, he or she, that this is the stage, but yes, I have to fight it out and give the best for the best outcome.
Absolutely. So when it comes to taking a holistic approach, the one person who is always involved is the woman of the family. She has to cook in a certain way. Some foods which are separately cooked for the cancer patient. So any specific foods to be avoided?
See, basically, whenever you are taking any treatment for cancer, we generally ask all patients not to have anything which is not boiled. To avoid raw food, vegetable, salads, you don't have it. Because any sort of infection in that particular food item, then they are bound to get infected first. Because their immunity level is very low. Cancer patients, first thing that gets hit is the immunity. Okay. And we don't want any secondary infection coming down to them and derailing the entire treatment course as well as deteriorating the health of the patient. So raw foods should be absolutely avoided.
When we speak about, again, जो cookware use होता है खाना बनाने में, it can be sometimes now there is a trend of air cooking, air frying, what we call it. So rather than doing for a deep fryer, but there is also research papers which state that you can't be using it on a daily basis. So,
see, basically, what is most important in terms of cooking, whenever you are preparing in any utensil, right? So different utensils, non-sticky, sticky, they have got different scientifically things have not been proven down on a scientific paper till now, but yes, there are few supportive evidences which tells, see, whenever we are preparing the food and taking the food out of that container, few people have the habit to go till the last ml of it.
Correct.
Don't go and keep on scrapping that. Then what you are doing, you are bringing that down here which has been fully charred. You take it from above and just have your, right? And secondly, pertaining to your query of whether it should be deep fried, air fried. See what it happens whenever you are taking air fried, as it is more healthy, right? And you are putting less oil into it. So there is less consumption of overall cholesterol, right? And that is definitely good for your health because it is not going to alter your lipid profile too much. At the same time, it is going to give you, say, proteins and carbs based on the a substance that you're consuming.
So to keep a track of these proteins, do you ever, track it through the body composition report as well?
Yeah, we definitely use InBody, right? Where we have scientific documentation. Say we have a protocol at Tropi. On the first day when you register with us, we don't curate anyone's protocol without having the numbers with us. So that is our first day when you get enrolled into our ecosystem. Then we map down your journey from first day, that is 0 day, 30th day, that is completion of 1 month, how you're doing. That is just to check. And if you see improvement in your numbers, then you feel happy that I should do it more. Then on 90th day. So this is a 3 months program. Then the similar cycle gets repeated based on the patient's performance or outcome after completion of 90 days.
Absolutely. So does BMR actually get affected because of this? So if we are talking about the basal metabolic rate, at times it drops suddenly or it can increase suddenly as per fevers or something. What happens in these cases?
In cancer,
Yes.
you see cancer definitely BMR affects, right? In cancer, whenever you see the basal metabolic rate, you're on a catabolic phase. So it affects significantly. And we have to stabilize the BMR. So whenever we do all these tests, when patient gets diagnosed, we see all the parameters which is making the BMR unstable. And we try to stabilize the BMR. Because if your BMR is stabilized, then the entire thing is going to get to a normal zone, say over a period of time. It might be either 90 days or 180 days. But that's where we keep our work or focus.
Also, are there any times when inflammation has become a significant obstacle? Where there is edema, swelling, something like that?
See, cancer itself is an inflammatory state. Apart from normal inflammation being present in the body of an individual, right? Due to diabetes, due to various factors, somebody might be having immunological disorder, but cancer itself is inflammatory. You see the markers of all cancer patients, you will see all raised inflammatory markers, right? But what is most important, how much they are raised, whether they are slightly raised, moderately raised, or severely raised, right? But if they are having significantly inflammatory markers, what it happens, their recovery gets delayed. They face issues in terms of getting themselves weaned from ventilator, if someone is on ventilator, in terms of delayed wound healing, right? In terms of delayed recovery, and they're easily susceptible to side effects. Suppose they're taking chemotherapy or radiation therapy. A normal individual without inflammation will have less side effects of chemo and radiation, but an individual with high inflammatory markers is more susceptible to side effects.
So, in terms of inflammation, normally as dietitians, what we do is salt restriction is done when somebody is a hypertensive patient or something. In this case, when salt restriction is done, does it affect any way or?
See, basically, we don't allow patient to have a completely salt restricted diet.
Okay.
Only salt restriction, and that too specifically iodized salt restriction, is done for patients with thyroid cancer.
Okay.
And that too for a short period of time, say after surgery, till the time they take the radioactive iodine treatment. Once they have taken the radioactive iodine treatment, then they can have complete salt consumption, and we don't discourage low salt intake unless there is some sort of other medical comorbidities which warrants the same.
Right now, you mentioned about different type of cancer. Which is the most prevalent type of cancer which you see nowadays?
See, in Indian scenario, out of 100%, 30 to 40% are head and neck cancer. And if you want to divide is based on the, say, gender proposition, males most commonly head and neck cancer, females nowadays breast cancer. Okay. Previously in females, cervical cancer was the most common, but due to HPV vaccination, due to good menstrual hygiene, that has reduced. Breast cancer is now the first most important.
So sometimes because of the hormonal issues, or sometimes because of the different body compositions which males and females have, certain precautionary steps have to be taken differently for females. So to avoid this or to prevent this type of cancer, any specific tips from your end?
See, what is most important, any female or any male specifically, they should undergo screening, which should be done like for females from the age of 30. When they reach close to the age of 30, they should always perform pap smear once a year.
Okay.
Right. When they reach the age of 40, they should perform mammography once a year. If there is a family history, that can be reduced to age of 35. Right. and at least ultrasound of abdomen and pelvis once every 6 months. So if there are small things, early indications, we are in a position to catch it up. Now with genetics being progressing so much, we are doing genetic tests for preemptive diagnosis if you're going to have something in future or not. And it has got good sensitivity and good predictability. In fact, I myself have done a test for myself so as to understand, am I prone for some cancers in future or not? What is the current overall? So it's not only about curiosity, you keep a track on that thing.
Correct.
Like my report has shown that I should not be going out in the sun because I'm prone for skin cancer. So my exposure to the sunlight should be there, but that does not mean I'm unnecessarily roaming out of the sun. So I'm just giving you an example. We have tests like that. Somebody who has got, say, risk of breast cancer, they will be much more cautious. They'll be doing mammography every yearly, if required, ultrasound every 6 months of bilateral breast. Similarly, in ovarian cancer or abdominal cancer, ultrasound of abdomen pelvis. So what is most important in Indian scenario is that patients should be doing more and more screening, which we are not generally accustomed with. प्रॉब्लम कैसा है इंडिया में, जब घर में आग लगती है तभी हम दौड़ते हैं, तभी फायर ब्रिगेड बुलाओ, इसको बुलाओ, इंश्योरेंस है क्या, कैसा करना है, कौन सा डॉक्टर है, सब सबने सबसे पहले तो इंश्योरेंस कर ही लेना चाहिए, ठीक है। एंड डोंट थिंक ऑफ इट क्या उसका प्रीमियम हम फालतू में भर रही है। एक बार जब बॉस हुआ ना कुछ भी कैंसर या ऐसा कुछ बीमारी, वो पूरे 20 साल का प्रीमियम आपका निकाल देंगे।